Everyone else is sitting. I'm gonna feel bad if I'm standing here. Like,
Sure.
oh, there we go. I was hoping you would leave it up there and my face wouldn't be on you.
Oh, okay. All right. So, all right, everyone, please pay attention. And if you get sleepy, you can stand in the back. All right. Thank you, Veronica.
Okay. So I'm Veronica. She already said. I was a pre-med student. Now I work in healthcare. Not as a clinician. I work in operations. So I do not see patients, but I see a lot of patients. I'm also a fellow at the National Catholic Bioethics Center, which is based up in Philadelphia. And I'm also one of Felix's older sisters. So if he ever causes you trouble, you can come to me. So I guess just to start with some definitions. Transgenderism, gender identity disorder, is when your sense of whether you're male or female contradicts with your biological sex. So you're born male, you're born female, and at some point your internal idea of am I actually male or am I actually female contradicts with your body. Up until a few years ago, this was classified as a mental condition. So if you went to a doctor and you said, you know, I'm a girl, but I feel like I'm a boy, the doctor would treat that as a mental problem. They would say, well, clearly your brain is not aligned with reality because your body is obviously one thing and your brain thinks it's the other thing. So we're going to treat this as a mental condition. That changed a few years ago. So now if you go to the doctor and you say, I'm a girl, but I think I'm a boy, they'll say, well, clearly your mind is right and your body is wrong. So let's do something to your body to switch things. Which is a little backwards. And it's also different from how we treat all other mental disorders. So if you go to the doctor with like anorexia, the doctor is not going to say, you know what, you're right. You're not anorexic, you are fat. You know, let's give you some diet pills and we'll do liposuction if that doesn't work. You know, no doctor is going to say that because they'll kill the patient. The doctor is going to say there's a problem with your brain. You think you're fat, but you're actually not fat. So we're going to fix that problem. That's usually how we treat mental problems, except for transgenderism. That's the only one where we say, okay, actually, your brain's right. Let's mess with your body. So that's what it is. That's both how the church defines it. That's also how public health defines it. So that's the general condition. It's, I would say it's unusual, but it's not atypical. So when you're going through puberty and you're changing from a child to an adult, it is very, very common to have some sort of mental, emotional, whether it's distress, depression, questioning, feeling uncomfortable, because both your body and your mind are going through a massive change from child to adult. So it is not unusual to have some sort of, you could just say like unsureness in there. Out of all the kids who feel like that, there is a subset of them where that develops into, I feel like my gender is wrong. So it's not really like a new problem or necessarily a weird problem. The weirdness is how we're now reacting to it. So where society is saying, you know what, we're not going to correct these kids and help them conform with reality. We're going to turn around and say, you know, you have a delusion, but it is correct. And now we're going to permanently mess with your body, you know, to the point where you're now messed up for the rest of your life. So that's the basic condition. One thing to keep in mind is a lot of people get confused between sex and gender. So your sex is a biological reality. You were born male or female. That is hardwired into your chromosomes, your DNA. That cannot be changed. We talk about sex change operations. There's actually no such thing because you can't change your sex. And there's no other sex. It's either male or female. There's no, you know, we don't have like 4 or 5 6 whatever sexes. There's really only those 2. And that's both something, it's in Genesis, male and female, he created them. And it's also something you can just see by looking at the world around you, right? There's only 2 kinds. So that is your biological sex. Now you can change certain characteristics. You can, either use surgery or drugs to mask characteristics so you appear to be the opposite sex, but you are not actually changing your sex. You're not actually changing your genes and your chromosomes. Gender, so that's your sex. Sex is sort of the foundation for your gender. So gender is also masculine, feminine. And the way we are designed, male sex, masculine gender, female sex, feminine gender. And ideally, your internal sense of who you are as male or female aligns with how your body was created as male or female. But we live in a fallen world, so there is sometimes a disconnect between your body and your soul. So, that can lead to feeling like you are not who you actually are. Gender is, it's based on your biological sex, but it's very much shaped by your culture, your upbringing, your psychology, your individual personality, and it also changes as you age. So it develops from how a 7-year-old expresses gender is going to be very different from how a 27-year-old expresses gender, because it matures as you age and develop and become your own person. So that's also important to keep in mind when people are talking about sex change operations or gender change operations, that they are connected, but there is a difference there between the 2 things. The church's position is that every human person is an embodied soul. So you are not a random body with a random soul, but the 2 are one. And that your specific soul was created for your specific body from the moment of conception. This is one of the reasons we don't believe in reincarnation, right? Because my soul is specific to my body, and even when this body dies, I can't come back as another person or as a male or as a squirrel or whatever, because this soul is specific to this body and this body only. And that's hardwired. That is true from the moment of conception. The second part, like we were sort of saying earlier, is that there are only 2 sexes, male and female. And then the third part of the church's teaching is really just that no one is transgender, right? There is no such thing. Someone may feel like they are transgender, or someone may be in the mistaken belief that they are the wrong gender or that they're in the wrong body, but God does not create people with switched genders. It just doesn't happen. So you probably don't want to throw that out there, right? Right when you're first talking to someone, that there is no such thing as transgender. But that is the official church teaching. There is no transgender. It's a made up term for something that doesn't exist. Philosophically, it can be hard to explain this to some people, because the idea that the body and the soul are linked and not separate is kind of a uniquely Catholic position. So if you're talking to someone who's not Catholic or not Christian, that can be hard to convince them of, because a lot of people have this idea that you have your soul or your animating principle or whatever, and you have your body, and they just happen to coexist. The church's position is that they're designed to coexist, for all time and eternity. So that can be very hard to get across if you're trying to argue with someone. But that is the church's position. And it's never, your soul is never going to be contrary to your body, because God doesn't make mistakes. What else did I want to say about the church's position? When you express your gender, like I said, it is highly dependent on culture and personality. There are certain sort of traits and characteristics that we would say are more masculine. There are certain traits and characteristics that we would say are more feminine. But it's not two distinct camps, right? So, and just because you have a trait or characteristic that is from the opposite sex does not mean you are that sex, right? So I have 7 brothers. I grew up playing with trucks and guns and making model airplanes. And I still like to do all those things. But that doesn't make me masculine, right? That just happens to be how I grew up and my personality. And you wouldn't say because I have these masculine traits or these, what we would call traditionally masculine occupations, therefore it makes me male. On the flip side, I can't draw beyond stick figures. One of my brothers is an amazing artist. He has like sketches of his wife and his baby all over the house. But, you wouldn't go to him and say, oh, he's a really great artist. That's sort of traditionally feminine, therefore he's female, right? You don't look at the characteristics and, sort of the leanings or the interests of somebody and then use that to determine what sex or gender they are. You look at their body, which is hardwired and unchangeable, and that determines what their sex is. One of the things to remember when you're talking to people like this is you are probably the only person who will say something to them. Very likely they're not around a lot of other Christians or Catholics. And most people are either, gung-ho for what they're doing, or, at least sort of giving tacit approval to their lifestyle. So not that you shouldn't say something to people, but just be aware that you're probably one of the only dissenting voices to come in and say, this may not be right. And also be aware that, very often these feelings arise from a place of confusion and mental anguish. And so really think about it charitably of like, how are you going to address this? Because there's probably a lot of internal disturbance going on already. So, not just don't discriminate and don't be mean, all the normal human things, but also, be overly charitable and overly kind because, they're already coming from a place where internally they're probably not that feeling that great, for lack of a better term. The other thing to keep in mind is that, particularly as they go further and further into this lifestyle, they're going deeper and deeper into sin, which again is not going to make them feel great. They're sort of digging the hole further and further down. So the longer someone has been like this, kind of the more compassionate you need to be, and probably the slower you're going to need to take things in terms of talking to them. Because it's not, the longer they're there, the harder it's going to be to get them out. So keep that in mind also. You do have, so you need to be charitable. You need to be loving, but you also need to sort of be aware of false charity. A lot of times what'll get thrown at us is, like, oh, Christians are supposed to love everybody. God said, love everybody, so therefore you need to accept me how I am. But, we're also supposed to admonish the sinner and counsel the doubtful, and what Aquinas calls fraternal correction, right? We're supposed to correct people who are in error. And beyond that, if someone is asking you to, confirm that they are the gender that they're not, or to use pronouns that would not be correct for their gender, or to use a name that would not be correct, that's really lying. So you don't want to lie yourself, obviously. And you also don't want to lie to them, right? You don't want to confirm them in their wrong thinking. Even if they, desperately seem like they want you to lie to them, that's not charitable. So when you say something, how you say something, is really kind of a matter for prudence. You probably, if you know someone who's transgender, or you meet someone who's transgender, you probably don't want to say something to them every single time you meet them, because that's not going to go over too well. And how you bring it up and what exactly you say is going to depend on your relationship with them, how well you know them, and that's something that you kind of have to judge individually and definitely pray about. Talk to the Holy Spirit and say, hey, help me to say the right thing at the right time to this person. You always, and this is true not just of transgender people, but of anyone who's saying, you always have an obligation to correct them. How great your obligation is depends on what your relationship is with that person. So if it is a family member, if it's your child, sibling, cousin, aunt, uncle, whatever, you have a greater obligation because you have a closer relationship with them. If it is someone in Starbucks, you have relatively low, there's never no obligation. You always have some level of obligation. But if it's someone you hardly know or you just bumped into, it's much less of an obligation to correct them. These are just some random things that you can throw out there. So transgender surgery is sort of the ultimate level of that. So there's sort of three stages. You have socially transitioning, which would be dressing like the opposite gender, changing your name, changing your pronouns, all sort of external stuff. The next step is hormones, which would be taking the hormones for the opposite gender. Depending on your age, hormone therapy may or may not be reversible. More than likely, you will, if you start it and you want to continue, you will be on hormones for the rest of your life. So it's not like a one and done sort of thing, like I can do this and then I'll forever be changed to the other gender. No, you will be taking hormones for your entire life to maintain whatever it is you want. The step beyond hormones would be surgery, which is, it's called surgery. It's really just mutilation. So basically, we remove parts that are completely fine and functioning normally, and then you don't actually add parts back. You just add things that look like the parts of the other gender. So cutting off parts of your body that are fine, and then we're going to add, flesh from your arm, flesh from your legs to make it look like you have the parts of the other gender. They will not be functioning though, so they won't work basically. So it's it's kind of disgusting. And it's not like you're correcting a problem with the body, because there's nothing wrong with the body. You're making it look like you are the opposite gender, which supposedly will correct the problem with your mind. Aside from the moral issue, it is irreversible. So you do transgender surgery, you cannot switch back. Like you cut parts off, they're not growing back. We can't really put them back. So that is a significant step to take if someone wants to do that. There's a high incidence of incontinence because you've taken parts off that were working fine and there's no new part there. So that may seem like a small thing, but certainly, something to throw out there. Like, do you want to wear a diaper for the rest of your life, basically? And ultimately, it doesn't tend to fix the underlying issue, which is they have a mental problem. There is a very high incidence of mental issue, so other mental issues with people who have gender disorder. So most of the time when someone comes with gender disorder, gender dysphoria, that is not their only problem. Something like 70 to 80% of patients also have another diagnosable mental issue. So whether it's depression, schizophrenia, bipolar, a lot of people on the autism spectrum end up with gender dysphoria. Sometimes it may be from past trauma or some previous event, but it's relatively rare that gender dysphoria will show up alone. And there's also a very high suicide rate among transgender people. It is something over 80% of transgender people have suicidal thoughts, and around 50% will attempt suicide. And that is whether or not they are out, that is whether or not they've had surgery. So when people say, oh, I'm suicidal and surgery is going to fix it, or hormones are going to fix it, it does not. 50% of them, before surgery, after surgery, will attempt suicide, which is like a crazy high percentage of people. There does tend to be a temporary mental improvement immediately after starting hormones, and immediately after surgery. So usually in the year or two afterwards, people will feel better. Their mental health will improve. They'll be happy. They'll be like, this solved everything. I'm great now. I'm living my new life. But then what you see long-term is generally over the next 10 years, they'll end up right back where they started. And it's not just suicide. There is a high incidence of these patients ending up in inpatient psych wards. They have about, I think, outside of committing suicide, they have just a basic, I think it's like 10 to 15 years lower life expectancy. So, they're also dying of other things faster, earlier. There's an increased rate of criminal activity. So it's just, it's a whole boatload of things that are all going together. And, what people try to tell you is, well, it's because they're being discriminated against or they're being bullied. And that's why, we did surgery and they're still suicidal because everyone hates them. Which is just not true. I mean, we're in the middle of a whole month that's throwing parties for people. They're being invited to the White House. So they're not really being bullied. Or if they are, it's sort of outlying cases. It's certainly not the community as a whole. That is that. I think what else I wanted to say about the church's position. If you are ever in a case where you can counsel a child who is going through this, I think it's much more dangerous for children than for adults. Children don't really have the capacity to make a decision of, I'm going to have, life-altering surgery or hormones that are going to completely mess me up. That's just not a decision a child can make. We don't let kids have tattoos. We don't let kids, drink alcohol. We don't let them drive. There's a whole slew of things where like you're too young to do that. Except for permanent gender surgery, they're fine. So if you're ever in a position where you can either influence a child or influence parents, that's something very, very important. The other thing to keep in mind about kids is they've done a few studies now, both in the U.S. and in and something like 70 to 80% of children who have diagnosed gender dysphoria spontaneously resolve it by the time they reach adulthood. So that's not like 13-year-old shows up and then we send them to conversion camp and they're fixed. That is 13-year-old shows up, we diagnose them, we don't do anything one way or another, spontaneously, as when they're an adult, suddenly the gender issues are gone. So that makes it very, very unethical to be pressuring kids one way or another. And it also makes it very, very important, if you ever have a kid like this, to make sure that you're talking to them and confirming them in the truth rather than confirming them in their confusion. That is kind of most of the points. I know I didn't talk that long, but I wanted to leave a lot of time for questions, and then also we can talk about euthanasia if anyone wants.
So when you're talking about gender identity and how you're defining gender and stuff, you said that it was linked to sex, which is obviously true. But like the definition of gender identity as an expression besides sex sort of is more of a new definition as opposed to and it kind of comes from like how gender identity has stemmed, like the ideology kind of stemmed from like Kinsey and John Hay and stuff like that. And it's a new kind of like revised definition of what gender was really just like the grammatic description of sex. So couldn't it be confusing to kind of adopt the revised terminology of an ideology that's so opposed to church teaching, as opposed to talking about gender? Like what people call gender identity is really more just like personality. Like if you tell someone like, oh, you have a masculine gender identity, but you're a girl, as opposed to saying you're a girl who has more traditionally personality traits or like hobbies found that mostly men, like,
I mean, yes and no. So that is a new definition. The church has not definitively said what gender identity is. Various people within the church, our bishop, for example, has adopted that definition. I think just for ease of talking between the two groups. You're right. I don't think it's necessarily a great definition because it does sort of give the illusion that there is a separateness that you completely can unlink gender and sex, which is just not true. They're always linked. I think what people are trying to get at is sex is absolutely unchangeable. Gender comes from your sex, but is there can be overlapping gender qualities between the two sexes. What other questions? Yes.
What you're saying, like obviously, like we made male and female. There's someone like who's transgender because they're maybe this way God has feminine traits or whatever. They don't like who we're dressing God is like only masculine. So like I'm feminine and I have all these traits and it's a strong God if you must be a female. Like how does someone if someone says like God's a woman basically and it's like I have these things because of that. Like what's the response? Are you like points on that kind of topic?
I mean, really, it is neither male or female. Not in the way we understand it. I would say, yes, God has male and female attributes. But within humans and really within all of nature, they are separate. So God is not going to create someone with a male sex with 100% female attributes and vice versa. And that's not just humans, that's any animal. So they may think that this is how God made them, but it's just simply not in line with reality.
I would also say that God is just complicated and simple beyond our understanding. So to try to make a point like that betrays a misunderstanding of the fundamental nature of God. Which is sort of a cop-out answer, but is also the best answer.
What other questions, comments, concerns? Yes.
I've heard from some people that since God was born of a virgin, but he walked the earth as a man and was transgender.
Is he only got the female who's
I mean, it is interesting to think of like Jesus would have looked pretty much a lot like Mary, and obviously not at all like Saint Joseph. I mean that doesn't make him transgender. He was still, when he was conceived as a male, and he spent his entire life as a male. It's not like we have Mary here who's a female and she duplicated herself and made a clone, and the clone is Jesus. It's not how it worked. So yeah, that would be my answer to that.
It cracks me up because it's like the same person who says, I believe in God and I believe that Jesus was trans, believes that God can transcend science by becoming incarnate, but doesn't believe that he can make them one male.
You can't.
Just two quick things just to kind of make that in order to have gender ideology, you need to have there's a lot of things, but two of the foundational ways of thinking. One, that reality is internal, that my feelings and emotions are what define reality, and that reality is not something outside, extrinsic, right? So that the way I feel means that's the way it is. Raise your hand if your emotions are always stable. Exactly. So, liars. The other thing is, now because of that, if I think, so this is kind of like a conclusion logic thing. If I believe, or I have the understanding that my feelings and emotions are what determine reality, then I become my own author. So we are not our own author. We were created specifically by God, who is the author of all, and intentionally authored you. So it's not based on me to author myself and based on how I feel. And emotions are there, they're not bad. I'm not dissing emotions because they tell us things, and we shouldn't throw them away, but we also have to understand that they aren't always dependable, and we have a choice on how we respond to them. So I'm not my own author because God authored me. And so it's therefore my life is a gift to me from God. So God gave you, and he knows you. Go to Eli. He made you, and he knows every little bit of you beyond anybody. And so you're discovering yourself through the person of Jesus Christ, who is the Son of the Father, the author of all. Thanks so much.
Yeah, no, and that that actually sort of springboarding off of that, that's why this is immoral, right? Because you might say if it's a mental issue, why is it immoral? Because you are rejecting God's plan for you, right? You are trying to go the opposite of how you were designed. And the further you go along there and the more permanent things you do, the more immoral it becomes because the greater the rejection is.
You did mention because it's a mental illness, or issue, I should say. How would you treat that? Like, if you're not like for it or whatever, but like if it is a mental problem, like anorexia, like they have medications for most mental problems. Like, is there a medication that they give people like this?
Well, so it sort of depends how it presents. If it's something that, for example, is causing you a lot of depression or a lot of anxiety, they can certainly give you medications to sort of treat those symptoms. Ultimately, it's probably going to be a lot of therapy, though. In the same way as if someone walks into the doctor's office and insists that there's a pink elephant there, you're like, well, that's obviously not real. We're going to sit down and hopefully, get you to the point where you understand that the pink elephant you're seeing is not real. That's not reality. So it would be a similar thing with gender dysphoria, where yes, there are medications that could treat some of the symptoms that may go along with it, but ultimately to treat the dysphoria itself, it would mostly be therapy. Yes.
What's the best response if someone is trying to convince you that you are either transgender or like anything to them?
I would just say that, that's God doesn't make people that way, right? It's not a thing. You might feel like you are that way, or you may have tendencies towards that way, and it's not just like with any other sin. Feeling gender confusion or having a tendency toward it is not a sin, right? It's a temptation, just like a temptation to anger, a temptation to envy, whatever. What makes it a sin or what makes it immoral is if you then give in to that temptation. So, if you're feeling that way, or if someone is telling you you're feeling that way, I would sort of treat it like any other temptation and say, and not to say that, not to discount the feeling or not to discount the distress that may come along with it, but just to understand that that is a real temptation to a sin, kind of just like any other temptation.
What is like a gentle way to like correct somebody if like they're transgender or whatever and they feel like they've found Jesus and everything, and like, but really like they're very trans or like very for it.
Just tell them they're going to hell. So it's sort of it really depends on the person and the circumstance. So if they're Catholic, I would probably try with starting with, this is the teaching of the church, right? This is, so if you want to be Catholic, you kind of have to go along with the teaching of the church. If they're not Catholic, it can be a little more difficult. The church position is not, it's not revealed, right? It's not like Our Lady said this at Fatima. This is all actually natural law stuff that you can get to just by being human. You can argue to this point. It's just much more difficult if you're not Catholic to get someone to the position where they will agree that, yes, being transgender is wrong. I don't know. I like to go from nature. If you go to the cattle market down the road and ask someone, how do I know if I'm buying a cow or if I'm buying a bull? If they turn around and tell you like, oh, well, the bulls are kind of more aggressive and they fight with each other, and the cows, they tend to be more gentle and they sashay their hips when they walk, and that's how we tell the difference between the two of them because there's no other way. You'd be like, well, you're an idiot. So and it's sort of similar with humans. We don't look to sort of random characteristics or temperament or feelings to necessarily determine if they're male or female. We're going to look to what is their actual body, because that's not changeable. That's immutable. Yes.
What are some arguments you could use to people who turn to animals that can, like, I think there's a type of fish, I think it's a clownfish, that when they mate, they actually change their gender
Switch.
depending on, like, how their mating goes.
Yeah.
Female or
Yeah.
male.
And they
And then if the female dies, the
one of them
prime male
switches.
female.
Yeah.
Yeah.
I mean, I would say I'm not a clownfish. No, so it's bad philosophy, bad argumentation to take the exception and then base the rule off of that. So people will do a similar argument about abortion, where they'll say, well, we need abortion because there's these cases of rape and incest. Cases of rape and incest are like 1% of all abortions. So you don't want to take the edge case, the sort of extraordinary thing, and say, this is how we're going to make our rules and our decisions and our laws. So I would probably the easiest response to the clownfish would be something similar. When you look throughout nature, 99% of them are one way, and then there's a clownfish doing whatever.
All in the world.
That's true. The clownfish still only goes back between the two. I don't know. I'm not a fungus.
Unless it doesn't have a gender.
We got one last question over here.
Yes.
What's a good way to respond to the argument that, like, what they're doing doesn't hurt you? You just
So I would say, first of all, what they're doing does hurt other people. They might feel like this is my private sin. It's not affecting anyone else. But, if you're rejecting the way you were born, it's going to hurt your parents. It's going to hurt your siblings, whatever other family. That's going to be a huge disruption and pain to all of them. So it's not true that it's not hurting anyone. Along with that, as Catholics, as Christians, it's simply not charitable for us to let someone destroy themselves, right? In the same way, if you're on a bridge and you see someone about to jump off, you wouldn't just sit there and go, well, they're doing that on their own. It's not going to hurt me, right? You're going to go and try and save them. And it's really no different with transgender people, right? We have an obligation through charity to try and help them and try and return them to truth.
Any last parting shots? Questions?
You said you were going to talk about, euthanasia too.
I can talk about euthanasia. Do people want me to talk about euthanasia, or do you just have questions about euthanasia you want me to answer? Euthanasia is bad. And done. Okay, so euthanasia, there's sort of two general kinds. One is active euthanasia, also called physician-assisted suicide, which is where a doctor will administer a drug like an overdose of morphine to actively kill you. The other sort of euthanasia is, you're all too young for Terry Shy, though. A lot of you are too young for Terry Shy. The other type of euthanasia is passive euthanasia, which is rather than actively administering something, you simply remove things like nutrition and hydration, and then you let the person die. Both kinds are bad. Active is worse than passive, but it's sort of like you're going to go to hell for both things. We can argue about which sin is which layer of hell, but they're both evil. In some ways, I think it's really linked to other things like transgenderism and abortion, because ultimately euthanasia is you're trying to escape pain, right? And people will look at it as like, this is a positive thing. We're letting these people suffer less. But suffering is part of human life. Some of us are called to suffer a lot. Some of us are called, not to suffer very much. But if Christ is calling you to suffer, then, it's your duty to accept it and to offer it up, not to sort of cheat out of it. That is sort of a Christian and Catholic notion, the redemptiveness of suffering. If you're talking to an atheist or someone who doesn't believe in God, it can be very difficult to get them to understand that suffering can have a good side, that there could be a benefit to this. Whether it's a benefit to the person suffering who's offering it up, or the benefit to the people who are caring for them, and thereby increasing in their own charity. Euthanasia, there's a lot of passive euthanasia that goes on, which is just, sometimes it's removing food and water and letting a person die. There are other forms, but that's probably the most common one. Probably the easiest way to tell if something is euthanasia or not is, if someone's talking about let's remove water, or let's remove food, just ask yourself, what is the person going to die from? If the answer is they're going to die from dehydration, or they're going to die from malnutrition, then you shouldn't be removing that, right? If the answer is, we're removing water and then they're going to die in a couple hours from cancer, that's not euthanasia. That's just the natural death process. So that's sort of a good watermark of just, if you're thinking about withholding some sort of medical intervention, ask yourself, are they going to die from me withholding this? If the answer is yes, then that is euthanasia. Don't do it. Or advise someone not to do it. What else? Any questions? Yes.
Can you talk a little bit about the difference between taking someone off of life support, like extraordinary means, and then like how that's different from removing ordinary means, like food and water? Like just how they're different and how
Yeah, so ordinary means, things like food and water, pretty much always required. Extraordinary means are things like life support. It might be some sort of surgery, some sort of particular therapy. May or may not be required depending on the situation.
My grandfather, a couple of years ago, he had kind of a stroke while he was asleep. And my grandmother noticed he wasn't waking up, he was just kind of lying there. So they took him to the hospital. It was determined he had a stroke. And so over the next couple of days, he was on life support. And the machine was breathing for him. There was really little brain activity. So at a certain point, my mom and my grandmother decided to remove life support. But he wouldn't have been able to sustain it on his own. And it was like he died from the stroke. And there was no chance whatsoever to restore any kind of functional, even breathing on his own. So I guess that would be one of those circumstances where it's not euthanasia at that point to remove the life support.
Yeah, and life support, something like a ventilator, if you are truly dying, it will not keep you alive for years and years. If you're really dying, a ventilator will keep you alive for anywhere from a couple hours to a couple days. It's not where, they're going to be on a ventilator for years and years. So, it's essentially what, your kind of case, if, in that situation, it's not euthanasia. It's, they're close to death anyway, and you're simply removing the ventilator. End of life issues, it's very, very case dependent. Extraordinary means it is going to depend on the case. It can mean things like if a therapy is too expensive, you're not required to accept it. If, like it's some surgery and it only happens at a hospital that is 500 miles away, that would be extraordinary means. You're not required to go and have that surgery. If it is something that is going to be extremely painful or extremely burdensome for whatever reason, that's extraordinary means. You're not required to accept it. Ordinary means you're always required to accept it. Yeah.
At that point, with extraordinary means, when you remove it, you're just trusting them to God, pretty much, right? So, you're allowing their miracle to happen, or for them to just pass.
Yeah, and it's it has to be in the judgment of the physician that yes, this person is close to death. If it's specifically like a case of brain death, the church's position is that there has to be no activity anywhere in the brain. That includes the hypothalamus and the brainstem. There can be no activity. Otherwise, you're not truly brain dead. A lot of doctors will try to say if there's low activity or if half of the brain isn't working, that's brain death. That is not church teaching. What else?
What about people who aren't like in that case, it would kind of be someone who's in a coma and you're not sure if they're brain dead. But what about like someone who finds out they're diagnosed with some sort of terminal disease and they don't want to go through chemo or extensive medication, and they just decide is it moral for them to say, hey, I could do these treatments, it's within my means, but I would rather just let nature take its course? What are the moral grounds for that?
Yeah, I mean, so you're not required to do something that is, so burdensome can mean, financially burdensome or distance wise, it's going to be burdensome, but it can also, simply mean it's going to be very painful or very uncomfortable. So particularly for something like chemo, it is perfectly okay to say, I would rather not be vomiting for the next year and just, have the 2 months I have left or whatever it is. So that's perfectly morally acceptable. What would not be acceptable would be to say, well, okay, I'm going to starve myself and, die in a week.
Or if it was an extremely easily treatable condition that you otherwise die from, just be I can easily fix this.
Yeah.
That would be,
yeah. So, if it's your child has an infection and you're well, I'm not going to give them antibiotics. I'm just going to, let their fever spike and then they'll die from a seizure. Yeah. That would just be stupid. And immoral. Cool. Anything else? Yes.
So, what about DNRs?
So DNRs you have to be careful about.
What's a DNR?
Do not resuscitate order. So they can be, it can be specific to resuscitation. So it can be very specific to if your heart stops, we are not going to do CPR, or we're not going to, get out the paddles and shock you. It can also be it can encompass sort of broader things of here's also another list of things we're not going to do should you enter, whatever state. A lot of times at that point it's called an advanced directive rather than a DNR, but there's sort of some overlap there. If you are in a situation like with our cancer patient who you already know you're dying, it would not be immoral to have a DNR or an advanced directive that says, if I have cancer, if I, now have a heart attack or a stroke, you don't have to take extraordinary means to extend my life. if you're a normal, healthy person, it's not immoral to have a DNR or an advance directive. It's just very unwise, because it's you can't anticipate everything that's going to happen to you, right? And it's very difficult. You know, you may think like, you know, oh, I'm positive, I don't want to get CPR, but you may then end up in a situation where you're unconscious, and you know, CPR might very quickly fix whatever made you unconscious, but suddenly you have a DNR, so now you're just going to die. And same thing with advanced directives. You know, like people may say, oh, I never want a feeding tube because that's horrible and I would just rather die. But then you may find yourself in a situation, you might have a car accident and you need a feeding tube for a couple days just to get you through. But, you know, suddenly you wrote this paper and signed it that you never want one. So you just have to be very, very careful about those. The church's recommendation is that rather than having a DNR or an advance directive, that you designate someone as your power of attorney. Obviously someone who's intelligent and Catholic, not a random person. But if you designate an individual rather than, you know, writing it down and trying to list every circumstance that might happen, if instead you have, you know, a good Catholic who will be acting on your behalf and who knows your wishes, that's sort of a better way of ensuring that both that your wishes will be in line with the Catholic Church and that they'll be in line with whatever you want.
For the same thing, say somebody has a DNR, so they don't want to be given it. How would you respond to that? Someone's gonna die unless you don't want CPR.
I would
Do it anyways.
forget where the DNR paperwork is.
Yeah.
It's sort of, legally you are required, you know, like if you're in a hospital or, you know, you're working in an ER or whatever, legally you are required to abide by whatever is written in the DNR or advance directive. Practically, I would probably ignore it, you know, because, you know, certainly if it's something where they're going to die anyway, it might be okay to abide by it. If it's something where you're looking at it and you're like, this is just, they didn't really think about like that this circumstance would come up, or, you know, they didn't really anticipate what was going to happen, I would probably ignore it. And if they want to fight about it when they wake up, that, you know, at least they wake up to fight about it.
Would it also be a little bit gifted? So would it, because then there would be a difference between like working in the hospital setting and being like, I have this patient, I know he has a DNR, he might like code at any second or whatever, and I know not to assist me, whatever, or you might have like someone that's like, this guy's heart stopped, and everyone just rushes in, and someone later is like, oh, this guy had a DNR, or like you just see someone on the street and you're like, I'm gonna save them.
Yeah.
So those are all.
Yeah, and the other thing about DNRs is, especially if you're in a pre-hospital situation, like it's, you know, it's a random stranger, you're an EMT or whatever. A lot of people have DNRs that are not legally binding. So you don't want to risk that, like, you know, they handed you some piece of paper and then it ends up not being a legal DNR. So you always want to err on the side of caution in terms of treating them.
And like one thing that we were taught when I was going through a first aid course was like when they are awake and they tell you something, then you kind of have to abide by that. But as soon as they go unconscious, it's up to your own prudent judgment. Mm-hmm. And so at that point, as soon as they go unconscious, you can start CPR.
Yep.
Regardless of whatever they told you while they were still awake.
For the most part, yes.
Yeah. Would that be considered under Good Samaritan laws if you're like, if someone's like, I have a DNR, and you're like, too bad, you know?
Yes, so unless you, if you have some sort of license, Good Samaritan laws are a little more murky. But as long as you're unlicensed, then you're basically covered to do whatever you want. So do not get licensed. That's stay as a rogue paramedic.
Yeah.
All right, we're gonna have to go over to the church here in a second. But thank you very much for.